Imagine this. A really common surgery. One performed, over 700,000 times a year on people over 65 in the U.S. alone.
Yeah, huge numbers.
You'd just assume a high success rate, wouldn't you? A clear path to getting better.
Right. Seems logical.
But here's the unsettling fact. For knee replacement, one of the most common major surgeries for seniors, the failure rate is nearly 40%.
40%, that's significant.
It really is. Almost half of patients just don't get the pain relief or the mobility improvement they were expecting. It's not just surprising, it's frankly alarming. So today, we're doing a deep dive into why this is happening and maybe more importantly, what you can actually do about it.
And that contrast you mentioned between what people think and what the clinical reality is, that's really crucial here.
Okay.
When something is done so often, you just assume it's reliable, almost guaranteed to work out well. But the data, it shows something very different.
Yeah.
And it's not necessarily about the surgeon's skill, which is often, exceptional. It's about a much bigger picture.
Well.
Patient preparation, systemic blind spots, things people often aren't even aware of. Our goal today is really to pull back the curtain on these hidden factors.
Right. To empower people with knowledge.
Exactly. For truly informed health decisions.
Okay, so let's unpack this using knee replacement as our main example. It's incredibly common for seniors. And it often gets presented as, almost routine. Like getting your car serviced, joints worn out, replace the part, back on the road. That's kind of the narrative.
And that narrative can be dangerously simplistic. The reality, if you go into this without the right prep, the right info, you're basically looking at a coin flip's chance for the success you want.
A coin flip, wow.
Nearly half don't get the expected pain relief or mobility. Think about the personal costs, not just money, though that's significant.
But what's recovery time?
Independence, potentially, your whole quality of life. It's a huge gamble if you don't understand all the variables.
Let's make this real. Consider Margaret. She was 71, grandmother from Ohio, really vibrant. Loved her garden, loved playing with the grandkids, daily walks, typical active senior. But for about 2 years, she'd been dealing with knee pain.
Started small, I imagine.
Exactly. An ache here and there. Physical therapy helped for a bit.
Yeah.
But it got worse. Climbing stairs, even just getting out of a chair. It became really hard.
Right.
So her orthopedic surgeon recommended knee replacement. Seemed like the obvious next step, the path back to her life.
Makes sense from her perspective.
But then, 3 months after the surgery, Margaret's story took a pretty tough turn. Instead of that promised relief, she had chronic inflammation.
Oh, no.
Limited range of motion, and this deep aching pain. Different from the arthritis, she said, and sometimes worse.
And the surgeon?
Assured her it was normal, healing takes time. But 6 months went by, then 9, then a whole year.
Still struggling.
Yeah, she had to give up gardening. Couldn't keep up with the grandkids. Ended up more dependent on pain meds than before. She became one of that disappointed 40%.
Margaret's story really hits the core problem, doesn't it? If it's not always about the surgeon's skill, the thing we usually focus on, then what is driving these outcomes?
Right. What else is going on?
The truth is, success goes way beyond the operating room. It's not just the technical skill or the implant quality.
Okay.
There's this complex interplay of factors. Things many professionals, and definitely most patients, don't fully recognize or address beforehand.
And these factors sound quite basic when you list them, but maybe overlooked.
Exactly. Things like your muscle strength before you even get to surgery, your bone density, your overall inflammatory status, basically. How much background inflammation is your body dealing with?
That affects healing, right?
Hugely. Then there's nutrition, your social support network, mental health, even sleep quality. Every single one played a part in how well your body heals and if you get that mobility back.
Is there solid research on this?
Oh, absolutely. Compelling stuff. Johns Hopkins, for instance, found patients going in with weak quadriceps muscles. They were 3 times more likely to have poor outcomes.
3 times. Wow. But is quad strength routinely tested before surgery?
Rarely required as a standard step. It's surprising, isn't it?
Yeah.
Same with inflammation. Elevated C-reactive protein levels, that's just a simple blood marker for inflammation.
Okay.
Patients with high levels often have significantly worse recoveries. But again, it's often not part of the standard pre-surgical workup.
So it's like trying to build an addition on a house without checking the foundation first.
That's a perfect analogy. You might get lucky, sure, but why leave something so vital to chance?
Okay, so if these things are so critical, and they're being overlooked.
Yeah.
Is there a way for patients to, actively improve their odds before surgery?
Yes. Definitely. And this is where things get really interesting. It brings us to the work of Dr. Sarah Chen.
An orthopedic researcher.
That's Stanford, yeah. She spent a decade studying exactly this. Why do some joint replacement patients thrive while others, well, suffer?
And what did she find?
Her findings were honestly revolutionary. She found that patients who did about 8 weeks of targeted pre-surgical conditioning, she calls it prehabilitation.
Prehabilitation, okay.
Their success rates jumped from around 55%, that coin flip,
Yeah.
to approaching 85%.
Wow. From 55 to 85, that's a massive difference.
It's an astonishing shift from basically even odds to a high probability of success.
So what does this prehabilitation involve? Is it complicated? Expensive?
That's the remarkable part. It's elegant in its accessibility. It's multifaceted, but not overly complex.
Okay, like what?
Very specific exercises, first off. Strengthening the muscles around the joint that's being replaced. Then, personalized nutritional counseling optimizing for healing.
Makes sense.
Stress management techniques, too. We know those can reduce inflammatory hormones. And sleep hygiene education. Getting good sleep is critical for releasing growth hormones needed for tissue repair.
Right, sleep is huge for recovery. And the cost, you mentioned accessible.
In her studies, the total cost for this whole program was less than $500.
Less than $500 compared to the cost of the surgery or complications.
Exactly. It has the potential to save tens of thousands down the line. Fewer complications, fewer revision surgeries, less need for long-term care.
So this isn't just like wishful thinking or some fringe idea.
Not at all. This is solid, evidence-based science. It's been replicated in multiple studies, different medical centers. It works.
Yet, you said fewer than 5% of surgeons routinely recommend it.
That's the perplexing part. Fewer than 5%. It's this huge, baffling gap between the research and standard practice.
Okay, let's contrast Margaret's story. You mentioned Tom, same surgery, different outcome.
Right. Tom, 68, retired teacher, had the same knee replacement as Margaret, but his results, dramatically different.
Also.
He was back hiking, minimal pain, more active than he'd been in years, definitely in that successful group.
So what was the difference? Did he do this prehab?
Yes. But not because his surgeon pushed it. His daughter, actually, she's a nurse practitioner.
Oh, okay.
She'd researched Dr. Chen's work, got totally convinced, and basically insisted her dad follow a comprehensive prep program.
So Tom started preparing well before the surgery date.
3 months before, he worked with a specialized physical therapist. They assessed his specific muscle imbalances, created a plan. Tom said it felt less like getting ready for surgery and more like training for like a personal marathon.
Huh. So not just generic exercises.
No, very targeted. Started gently, balance, core strength, then gradually built up to more challenging moves for the muscles around the knee.
But you said it was multifaceted. Was it just physical for Tom?
No, not at all. He also saw a nutritionist. They focused on protein for healing, vitamins, minerals for bone health, anti-inflammatory foods.
The whole package.
Right. He learned meditation for the pre-surgical anxiety, which we know can impact recovery. Optimized his sleep habits, understanding that growth hormone release during deep sleep is vital.
Wow.
He even saw a counselor, talk through his fears about the surgery, set realistic expectations for the recovery timeline. It was truly holistic.
And the result was?
Exactly what Dr. Chen's research predicted. Much faster recovery for Tom, better range of motion, really high satisfaction.
So the difference between Margaret's struggle and Tom's success? It wasn't the surgeon or the hospital or the implant model.
It was the preparation. Tom's proactive, holistic approach before the surgery. That made all the difference. It really underscores that success hinges on preparation, not just the procedure itself.
Which, again, brings us back to that question.
Yeah.
If the evidence is so strong, if prehab is so beneficial, why isn't it just standard practice everywhere?
Yeah, it really begs the question, doesn't it? And the answer, well, it points to some uncomfortable truths about our healthcare system as it currently operates.
Okay, let's get into that. What are the barriers?
There are several systemic issues. First, you have to look at the financial incentives.
How so?
Our system often rewards doing procedures, interventions, not so much prevention. Think about it. A patient who recovers smoothly might actually generate less revenue.
Than someone who has complications.
Yeah.
Needs more visits, more therapy, maybe even another surgery.
Exactly. Now, I'm not saying providers want complications, of course not. But the system itself isn't really set up to financially incentivize comprehensive prevention as strongly as it rewards acute care.
That makes sense, unfortunately. What else?
Then there's the time factor. Real prehab, like Tom did, takes coordination. Multiple specialists, patient commitment, for weeks, maybe months.
And people are often in pain, wanting relief fast.
Precisely. There's pressure from patients and providers sometimes to just schedule the surgery quickly, get it done. The idea of waiting weeks or months to optimize, even if it improves the long-term outcome, can feel counterintuitive when someone's hurting right now.
Yeah, I can see that tension. Immediate relief versus long-term success.
And finally, there can be a knowledge gap. Orthopedic surgeons are incredibly skilled technical experts, amazing at the surgery itself.
Right.
But they might not be fully up to speed on all the latest research in holistic optimization. Medical training focuses heavily on pathology, on treatment, less so on prevention and comprehensive patient prep.
Continuing education might focus more on new surgical techniques than this broader stuff.
Often, yeah. New techniques, new implants, not always these more holistic approaches to ensuring patient success beyond the operating table.
Okay, so the system has barriers.
Yeah.
But what gives you hope here? What can people actually do?
What gives me hope is that you, the patient, don't have to be passive. You have power here. You can advocate for yourself or for your loved ones. You can push for the best possible outcome.
So what does this boil down to for our listeners? It means you have agency. You don't just have to roll the dice.
Exactly right.
You can ask the right questions, seek out the right help.
Precisely. So here are some concrete, actionable steps you can take. First, talk to your surgeon. Ask them directly about pre-surgical optimization programs.
And if they seem unfamiliar,
don't stop there. Ask for a referral, specifically to a physical therapist who specializes in pre-surgical conditioning. They exist.
okay, good tip.
Also, ask about blood work. Assess your inflammatory status, key nutritional markers. Simple tests, but they give crucial insight into your body's readiness to heal.
Get that baseline inflammation checked.
Yes. And ask about working with a registered dietitian, someone who understands the specific nutritional needs for surgical recovery.
So really, don't accept just show up on surgery day as enough prep for something this major.
Absolutely not. Your body, your future mobility, it deserves better preparation for a procedure that will impact the rest of your life. The science backs you up on this.
And it's not about second-guessing the medical team.
Not at all. It's about being an informed partner in your own healthcare. You wouldn't buy a car without checking its reliability, right? Why treat your own body with less diligence? Makes sense. The research is just so clear on this. Patients who actively participate in their prep, optimize their health beforehand, understand the process, set realistic expectations, they consistently do better.
Less pain, faster recovery.
Fewer complications, higher satisfaction, it all points in the same direction.
Okay, so wrapping up our deep dive today, the core message seems clear. Your health, your mobility, your independence. They're too important to leave to chance. And this discussion really showed that preparation, that pre-work, is absolutely key to unlocking better surgical outcomes.
It really is. Thinking back to Margaret and Tom, that stark difference, it so often comes down to what happened before they even got to the operating room.
A powerful lesson in taking control.
Definitely.
So the final thought for you, our listeners. The research shows that common senior surgeries, like knee replacement, don't have to have such high failure rates. But that change likely requires you, the patient, to refuse the status quo. To insist on the kind of preparation science has proven makes all the difference. What steps would you take today to make sure your future health isn't left to chance?